Typically, dietary advice is given as quite a generic piece of information. Now, we know as scientists that one size does not fit all, and now we have the science to back that up and give you the best possible care and really personalize our recommendations based on your DNA. Everybody is different, and that means that everybody responds to different nutrients very differently. One piece of advice might work for one person, but another person's genetics might impact that very, very differently. So having that basic assessment, not just clinical and dietary, which is previously what dietitians train to do, having the genetic assessment also as part of the consultation is so important in order that personalized recommendations can be given. When we can incorporate a genetic assessment into the consultation, that means that we can personalize your recommendations, and that means that we can give even more optimized health and really help with the treatment and prevention of medical disease. There's a lot of genetic tests out there on the market, and I think from the consumer's point of view, you need to know that you're getting not just a genetic test, but the advice that comes with the report is sound, evidence-based, and based on the best, robust scientific research out there. I've done a lot of research. I've looked at most genetic tests on the market, and I have personally, using clinical judgment and my own experience with patients, found a genetic test that is the best out there. The genetic test that I use in my clinical practice has been developed by Harvard-trained professors who now work at the University of Toronto, and it's actually their biotech company. So any of my patients who I take a genetic sample, which is a simple saliva test, I actually send to the University of Toronto where it's fully sequenced, and I then directly receive the report. It's very important that the patient understands that they're not just going to receive a genetic report and going to have to go through all of that complicated science themselves. The reason that I have been specifically trained in this area is to give my patients the best possible care and to be able to translate this very hard to understand material into easy to follow dietary advice in order to personalize their dietary recommendations.